like you, I suppose, I know I went through Medicare enrollment recently, and that, even though I've been in the insurance business for 35 years, it still had me stumped and baffled, and the language is obscure and unfriendly, and you have to do a lot of research to find your way through that labyrinth to find out where you belong and how is it going to work, and it's kind of scary, and you have months leading up to your age 65 birthday, and after age 65 you have 3 months. So there's the Medicare eligibility, which I'm not going to go into today. My particular field primarily has been individual health insurance, life insurance, disability insurance, long-term care insurance, which ties in maybe with financial planning and Medicare perhaps, because Medicare does not pay for long-term care when you're thinking that far ahead. Does everyone here currently have health insurance of some sort, either through Medicare, Medi-Cal, or on the private market in some way? Does anybody not have some coverage? Oh, well, okay, you have one. Well, you'll be hit with a surprise when tax time comes, maybe, depending on, there's the Affordable Care Act, which says everyone should have health insurance or pay a penalty, pay a tax penalty, which goes towards supporting the new rules which makes insurance available for everyone. So no matter what your health conditions are, unlike 2.5 years ago when I used to tell people, oh, because you had acne when you were 13 years old, you now have to pay 20% more for your health insurance, or you're just not insurable at all. I don't know what those people did once they got that news, if they were young and relatively healthy, but they had something in their past, maybe a heart attack or cancer, diabetes, stroke, whatever, you would just be uninsurable. And that was the state of this country, which led to the eventual implementation and the outrage and the public urging that something be done about it. And what we got out of it was the Affordable Care Act, passed in 2010 by Barack Obama, signed by Barack Obama in March of 2010, and signed by Congress and approved by the Supreme Court of the United States. So it's the law of the land, whether you like it or not. And it has a lot of very good features. I think it's a step in the right direction to provide health care for everybody at an affordable rate, because America is still one of the only countries that does, of the industrialized, financially sound countries, that does not yet provide health insurance for all of its citizens, as though it's a privilege based on income, for instance, or geography, perhaps. I was reading an article just this morning that came from the Commonwealth Fund, and it said the United States healthcare system is the most expensive in the world. And consistently, all the reports show the U.S. underperforms relative to other countries on most dimensions of performance, which also led to the creation of the Affordable Care Act, because I think it's like progression in real estate. If you have a nice house on the block, everybody wants to keep up with it. And I'll put a new paint job on my house because you've already done that. Now I'm looking pretty dumb here with my old wooden garage doors maybe, and my roof is losing shingles. So when they compared the United States with Australia, Canada, France, Germany, Netherlands, New Zealand, Norway, Sweden, Switzerland, United Kingdom, the United States ranks last, as it did in 2010, 2007, 2006, 2004. So the U.S. is failing to achieve better health outcomes than the other countries, and it's measured in various ways, such as life expectancy, that the U.S. life expectancy is less than it would be in England. It might be age 78 here on average. In England, it might be 81. Child mortality rates are higher in the United States than they would be elsewhere. People visit the hospital less frequently in the United States. They have less medical appointments, but the cost of care is 19% of the gross domestic product is going into medical insurance, into medical bills, not insurance alone. But the entire medical industry sucks up 19% of the gross domestic product in the United States, which sounds kind of crazy. So it's like $3 trillion a year is going in to pay for medical care, and we're not necessarily getting the best care out of it. But steps are improving. There's a gradual, we could call it a sea change, where gradually we're seeing the Affordable Care Act is making insurance more and more affordable, especially for low-income people. It's put constraints on the insurance industry. And I'll get into that a little more here in my slide presentation, which is the first time I'm doing this, and someone else's computer to boot, so hopefully I can do this right. So like me with Medicare, choosing a health plan, you have to be an Einstein. You have to really do some homework, because among other things, you have to make sure your doctors or your clinics or your hospitals are in the network for which you're signing up. So there takes a little bit, it's not, it never was simple. The Affordable Care Act simplifies, in general, as we'll get to in a minute, your choices. So you don't have necessarily 20, 30 choices from every company. It's been simplified, and the policies themselves have been bulked up to cover just about everything with unlimited benefits potentially available. The Affordable Care Act, as I said, was passed in 2010. Before that, insurance companies could increase rates, which led to the outrage, and everybody was going to do something about it. They were able to also rescind coverage. I never saw this happen, but other states in the country have much weaker enforcement of the insurance rules, and the insurance companies maybe were, I don't know, Mississippi, I don't know where, but Texas, people were having their policies rescinded after they had a claim. So insurance companies were able to do that, incredibly enough. They can't do that anymore. They have to accept everybody. Under the shared responsibility of the Affordable Care Act, we all have to participate or pay that penalty, which I'll get to in a minute, which only one of our audience members may pay most attention to, but hopefully none of you will have to deal with it. The penalty is still relatively small, and depending on your how you get your insurance, some people might prefer the penalty, but they won't have insurance. And you can't just get it whenever you want, which I'll also go into in one of these slides coming up. So insurance companies can't decline coverage or charge extra for any pre-existing condition for anyone here in this room. That's important because you could not get health insurance prior in December 2013. I would say wait a month, January 2014 is right around the corner, then your policy could be effective. So that was kind of a real relief for everybody. It also eliminates lifetime limits. So once you get into the hospital, when I started in the business, I remember policies that were being sold that had a $500,000 lifetime maximum, and we wondered, how would anyone ever meet that? That's so much money. $1 million, then it went up to $2 million, then $3 million, then $5 million, then some companies introduced $10 million lifetime benefits, and even that wasn't really adequate for some situations with people with cancers and one problem or another. So the Affordable Care Act now says every insurance policy you get you'll never run out of money once you're on a claim, depending on what the claim is and how you're being treated, of course. So children also, this came into effect back when the rule was first being implemented back in 2010. Children can stay on their parents' policies, their individual family policies, or their group insurance policies till the children turn 26, because the assumption is the 26, 25, 24-year-olds are indestructible. They'll never buy health insurance. But the idea is to get as many people into the pool so the pool of money that the country as a whole is allocating to health insurance is adequately funded so that people with severe health issues and sometimes the end-of-life issues where for many people, often the largest bills come in the last few years of life, how do the insurance companies pay this without going back into the cycle of increasing premiums as dramatically as they were? So children can stay on their parents' policies until they're 26. My daughter will be 26 next March, and then she'll have to get her own policy somehow. This is what I meant about bulking up the benefits of the insurance policies, is that there are 10 essential benefits that every insurance policy has to have in it, including ambulatory patient, which simply means outpatient surgery, or you're going into your office, you're able to ambulate. It's funny language, but they cover emergency services, obviously, hospitalization. It used to be, before 2014, I would say, do you want that with maternity or no maternity? Or would you like that with pharmaceuticals or no pharmaceuticals? And I couldn't understand how I could ask people, do you want pharmacy benefits as part of your health insurance policy? Because who knows, those pills alone could run $1,000 a pill a month, or a swallow perhaps. So that is now, the pharmaceutical is now built into the policy as well. Mental health, substance abuse, rehabilitative services, lab services, pretty much everything, including pediatric care for children. Well visits, annual well visits are now mandated, that if you go in, you don't pay anything to get a blood checkup. You could get bone density, checking for osteoporosis, get a colonoscopy as long as it's preventive and just a visit to the doctor, not because you already have some symptoms. Then it changes back into the deductibles and copays possibly, depending on the plan you have. But this is, again, I'm speaking primarily to individually purchased insurance policies purchased through the open market, like Blue Cross, Blue Shield, Health Net, Aetna, Kaiser, any of those companies, HMOs, PPOs, IPOs, whatever, all the different groups that have been other ways you can access individual health insurance for yourself, or through Covered California, which is an open market, which is an exchange of the same policy you'd buy off the market, but federal subsidies are available to help lower the premiums to keep it under control for people within a certain income bracket based on their income and their family size. So it's a process you go through when you get to Covered. If you're eligible and you think it makes sense to apply through Covered California, you'll get the same coverage you would get directly from the company, only you also become eligible for an advanced premium tax credit, it's called. Advanced premium tax credit means you may have to pay it back if your income turns out higher than you originally projected. For this year, for 2016, the penalty for not having any health insurance, if you have no health insurance for the year, and or if you go 3 months without health insurance, you're subject to a penalty when you do your income taxes at the end of the year. Currently, it's fixed at $695 for the whole year, or 2.5% of your adjusted gross income. So in any case, it can't be more than $2,000.85 per household, or 2.5% of income. So the penalties could be severe. Nobody wants to pay that. So there's really an economic incentive to push people into getting into the plans, because it's the partnership of the individual citizen, businesses who are providing health insurance to their employees, and the government, which is providing these subsidies and has Medicare, and then states that offer Medi-Cal. There's health insurance benefits at multiple levels of access. The question about when you can enroll is critical, because if you're having a health issue, you may not be able to apply. You have to apply during either the open enrollment period, which starts on November 1st of each year, goes through January 31st, and you'll start the month after you apply generally, or depending on when in the month you apply. So if you're waiting to have a health emergency, you may be in this in-between state where an insurance company can't pick you up. You just will have to pay out of pocket, pretty much, unless you can find other resources in the community. So there are other conditions, however, that does make it possible to apply outside of the open enrollment, like if you have a qualifying event, it's called, and that's if you get married, or have children, or get divorced, or you gain or lose a dependent, you change an immigration status, you become legally eligible for being as a U.S. citizen. If you lost Medi-Cal or Medicare, or you lost your group health insurance, perhaps the employee, you left your job, you got fired, you quit, whatever, that creates a 60-day window where you can apply on the open market for your own health insurance. And again, you can't be turned down. They have to insure you, whatever the reason, but you have to have these specific qualifying events. And so I suggested to one person recently, I said, well, it sounds like you have to get married or have a baby, one or the other. Otherwise, you're not going to get health insurance. I've heard of people doing things like that for, get divorced because it'll save you money. Let's see. As you may know, I assume everybody maybe by now is familiar with the 4 metal tiers. This is a general, but all insurance companies have at least these 4 levels. And these are the broad categories of health insurance: bronze, silver, gold, and platinum. And as you can imagine, gold is going to be the bronze, is going to be the least expensive, but it also will require more payments out of your own pocket for anything you receive, particularly pricey if you're depending on pharmaceuticals or any kind of drugs. You'll have to pay a very big portion, up to $500, before the insurance company will begin to share the cost with you for your monthly prescription. Silver is a little more expensive, but it doesn't have as high a deductible, and the medicines become more readily available. Gold, there's no deductible. There's nothing you have to pay up front before benefits. You can start to draw benefits and payments from your insurance policy. And platinum is the premier plan. It has the lowest deductible and the lowest out-of-pocket cost, but it also costs the most. So it still is it's probably the best policy, but again, the cost is for some people will be prohibitive. Silver is the one I think that was aimed at the general population, the silver plan, because it provides a combination of good benefits, low deductibles, low copays, and the premiums are still within reason. I then did some slides that actually goes over each of the plans. You have this in your booklet if everyone has one of these little pamphlets I handed out. If anyone doesn't, you can pick one up wherever they are. There's some on some seats here. And it goes over, all these slides are there, so you can always look at these later. And you still might need some help in navigating through this, like I said, and that's what a river guide is for. And me or another insurance agent or someone who is certified by Covered California can also guide you through the process of what's most appropriate in terms of your long-term or short-term needs, your budget. Sometimes it's good to have a two-way conversation. Like Medicare was very good. I could pick up the phone and somebody always answered the phone. Sometimes I'd call 11 o'clock at night, someone would answer the phone. And it was very helpful to have someone to speak to and take your application as the case may be. So as I said, the bronze plan has a high deductible of $6,000 out of your pocket before you start to get any benefits out of your health plan in a sense. Your maximum out of pocket, however, is limited to $6,250. So in a sense, everybody has a limit. And whereas one of the leading, if you remember back in 2013, up until then, that was till the Affordable Care Act was passed, one of the leading causes of bankruptcy in this country was medical bills. People going into, because they could not pay their $100,000, $200,000, whatever their medical bills were. So in any case, you're limited as an individual to no more than $6,250 out of your pocket. So there's probably much less reason for anybody to file for bankruptcy for medical reasons alone. It can be pooled in, but that's your office. After you, there are certain in the silver level. You have a deductible of $2,250, a maximum out of pocket $6,250. The bronze was $6,500. Sorry, I want to go back there. The bronze level, the out of pocket maximum with the bronze is $6,500. The out of pocket maximum with the silver is $6,250. But there's no deductible for your office visits. You can go see a specialist for $70, lab tests are $35, no deductible. It's really hospitalization, outpatient surgery, where the deductible will come back into play. That's where it could haunt you if you go in that direction. Again, this is in your pamphlets there. So it just gives you a broad overview. There's a lot more details, but this is what I think people are always asking me, and I say this is what you can focus on to keep it simple. Again, with the gold plan, there's a $0 deductible. Office visits are only $35, specialists $55. Pharmacy copays, there's no deductible for pharmaceuticals. So the gold is beginning to become a reasonably good plan for many people. And the platinum has no deductible, maximum out of pocket of $4,000. So that's your worst case scenario. And again, this is all going to be in your paperwork there. One thing I'll mention is health savings accounts, which are available primarily with the bronze level plan, and that allows you to put aside up to $3,350 into a tax deductible savings account that you can use for medical expenses when you set up an HSA, a health savings account compatible health plan, which is in the bronze category. How do you pay that high deductible? Well, you can use your own premium, your dollars you've saved into an HSA, and you could set that up with any bank or even online. There are online banks that you could set up a health savings account for yourself, and then you draw the money tax-free, and so it's tax-free contribution like an IRA, tax-free accumulation in the account, and tax-free when you take it out, so it's tax-free money that you're using to pay your own medical bills. It's a good thing to have if you can set aside some savings on an annual basis or monthly.
Yeah, we're going to take the questions at the end,
Yeah.
sorry.
Okay, sure, okay. Covered California is what many people are interested in because you'll get the same plans and there are a few extra incentives because there are some extra benefits for people who fall within certain income categories. If you fall within 400% of the federal poverty level, you're eligible for advanced premium tax credits, which will help you lower your premium on each month that you're paying your premium. So that's coordinated between the federal government, the state government, and the private insurance companies. And they all have to communicate with each other. And the IRS gets this at the end of the year, and you'll get a tax form at the end of the year, a 1095-A, telling you what credits you received, and then you reconcile it with what your actual income turned out to be for that past year. So you're making a prediction to get the credit, you make a projection as to what your income will be. You could be way off, but it'll be reconciled when you do your income taxes the following year. And that really helps people. Your premium could be low as $1 a month. I mean, if you get below a certain level, around 17,000 for an individual, you'll be eligible for Medi-Cal, and this brings you to Medi-Cal. Let me see, I'll just finish up here. And as anyone who's gone through the initial out, whatever you want to call it, the website when it came online in 2013 was horrible. I still have post-traumatic shock syndrome because I was on the phone for 3 hours and nobody would answer, and then the phone would go dead, and this happened again and again and again. The computer system would fall, and the government, of course, had the tech industry come in and set it up. And so that's my getting back at them. So if you have any questions at the end, I'll be glad to answer them. Hopefully the pamphlets you have will be very helpful to you. Thank you for your time. I'm really honored to be here with you all.
Thank you.
Thank you. I don't know if you want to.